Okay, let's look at Chapter 20 on here. Okay. Get through this. A lot of this you've probably seen online too, so we'll kind of go through some of it as a review. So, okay, so this one's going to look at long-term care facilities like the nursing homes. Did any of y'all go along with the med tech whenever we went to the nursing home rehab? And like a big cart with all their medicines in it. Usually people at nursing homes get theirs like a month at a time, but anyways. Long-term pharmacies, high-tech therapies, we'll look at TPN, hospice, and then a few other things. Okay, so long-term care can be any number of things. So usually you're looking though at like nursing homes or rehabs. Sometimes there's some other areas like Baylor has what's called the Children's Home, which is like a long-term care facility for kids, depending on what their issue is. So there can be places like that too. Or like an assisted living is really, I guess, kind of a long-term care. So at an assisted living, they usually, they need some assistance, but they don't necessarily need full-out care. And they kind of have I don't know if y'all ever been into an assisted living, but there's always a nurse on staff, and they have that kind of thing, but then they have, everybody kind of has their own apartment, so that they can they'll serve meals like in a cafeteria type setting, but they also have it's more of an apartment style place than a nursing home. Children with congenital abnormalities, so if they have something where they can't really live at home, they would not be a place. Somebody you'd see in a long-term care facility. Young adults with a long recovery period, so if they've had some kind of trauma, or elderly with disease, they just can't take care of themselves at home. So, kind of like what we just said. So it says licensed professional pharmacies or practices that provide medications and clinical services to long-term care facilities. So there's some specific pharmacies that they'll send their medicines to those places, and usually they're in like a month's supply, and they come in like this little, kind of like a little punch-out packet kind of thing. But these places are available 24 hours a day in case somebody needs to call in and order something and get it delivered. And then we'll go from there. These help to decrease medication costs because they can buy them in bulk if they need to. Adverse drug reactions and interactions, hospitalization, and mortality rates. So they're going to help with all of that. Oops. Going in the wrong direction here. Okay, consultant pharmacists. They interact with doctors, nurses, somebody else they just need that extra bit of information, trying to figure out what's going to work or not work and so forth. And so you'll see, like when I did home health, we had kind of a group of consulting people, kind of like and they weren't called the board. I don't really know exactly what the title was. I can't remember. I was there one time. But so we had a pharmacist we meet with every now and then that was kind of like a consultant, and a physician, those kind of things. So that and most places are going to have somebody like that. Okay, we talked about this before at the beginning of the year. This is the Medicaid law where we have to counsel the patient. So it says require greater pharmacist responsibility, participation in long-term care, safe drug distribution, control systems, and then reviewing the drug regimens. Helps with cost containment, so people aren't overbuying, overspending, and then patient care committees. Maybe that was more of a committee. And then developing some of it. So those are some other things that are on that act. Okay, home health care pharmacies, definitely one of the fastest growing parts because home health is really fast growing. Here's the thing, 20 years ago, people stayed in the hospital for a lot longer period to get treatment, and then they go home. Now, people will go in the hospital, have surgery, come home within a couple of days, and do therapy at home, nursing at home, IVs at home, whatever. And so it's really, it helps to contain costs because people aren't having, I mean, it costs a lot of money to stay a day in the hospital versus doing home health. You know, it's much cheaper for Medicare or Medicaid or whatever insurance company to pay for home health than it is to pay for the hospital. So pharmaceutical, of course, you know, this rehab, people can get therapy at home. I told y'all about like the IV medicines that I've given at home that come in those little bowls. Most, I would say, even probably more than that, Medicare-wise, payment for home care. Mostly, probably depends on where you are, I guess. But okay, other high-tech therapy, so IV antibiotics, chemo, some pain meds, like people have a pain pump, you know, that might be something that they have, or TPN, definitely kind of your higher end one. Enteral nutrition, so that's like if you've got a G tube or something like that, or an NG tube. Renal dialysis, and then respiratory therapies or some other areas. Okay, home infusion pharmacies. So these are specifically the ones that are related to like the IV drugs at home. So they're going to package them and dispense them. Like we can, you know, when I was doing the home health, if we got an order for an IV, let's say we got an order for IV LASIK. Sometimes every once in a while we get that because for whatever reason the pill wasn't working and they wanted them to have it right then. So we call them up. They usually have it delivered. They hand deliver it and they bring it and have it there by the end of the day. So we can give the best. Parenteral nutrition therapy. So nutrients are delivered directly into the bloodstream. We've talked about this before too, right? TPN. Got amino acids, dextrose, fats, everything, your minerals, electrolytes, vitamins, anything that you would need in your diet is going to go in there. And usually it'll have a list on the outside of the bag of what all's in there. And it is an extensive list. I mean, if you think about nutrient-wise, what all you need, you know, just learning about all of that in anatomy, what all you need, and what it takes just to keep your body going. And so all of that has to be in there. Oh, and insulin and heparin are in there too. Okay, enteral nutrition therapy is food and nutrients that are delivered into the GI tract through a tube, and that can look like a lot of different things. Okay, so it can be like through an NG tube. What is NG?
Nasogastric.
Nasogastric. So that means the longer tube, and it goes through the back of the nose, down the throat, into the stomach. It sits in the stomach. You can also have a there's another tube that actually goes a little bit farther than that, right into the top of the small intestine. Anyway, so that's one, and that can be, I mean, you can put that in somebody who's awake. It's kind of hard, and it usually gags them quite a bit, but yeah. So that's that. A G tube would be like a gastrostomy, where they have a tube that's actually going directly to their stomach. Sometimes people have a Mickey button, which is just, it's about this long, and it goes into their stomach too. But it's, you know, they can hook up to it, and it's just a little button looking kind of thing on their belly. They open up and put the tube, attach the tube to. It's not always like a tube. Used to get those a lot at children's. Kids would come in and their Mickey button had fallen out. I'd have to put it back in. You had to dilate that hole to get it to do that. But they kind of, you know, we've opened up a catheter before. You know how it's got that little bulb on the end to keep it in the bladder? Mickey button does the same thing. So you put it in, and then there's a little bulb kind of around the outside of the tube, and that's what holds it in to the stomach. Often used for patients with conditions that inhibit swallowing. So if they've got, for some reason they can't swallow, that's why they would get like a G tube or a G button. They have a stroke and can't swallow, maybe they have dementia, they're so confused that they can't eat and swallow, get choked. some kind of trauma. Maybe they've had cancer, like throat cancer or tongue cancer, something along those lines. There was one other thing I was thinking of. Okay, hospice pharmacy. So serves the needs of the terminally ill. And the goal really of hospice is not necessarily to make the person better. If they're on hospice, pretty well gotten to the place where they're not going to get any better. Okay, they have to be terminal to be put on hospice. And there's a specific timeline in there. And anyways, but hospice usually has their own pharmacy, like the hospice company will have their own pharmacy and their own durable medical equipment, all of that. They'll manage all of that. And really the goal is, it's called palliative care. That's just, that is, your goal is to try to keep them as pain-free as possible and comfortable as possible. Usually in the patient's home. But they can use a regular community pharmacy, but a lot of them only do, like a hospice has their own pharmacy company that they deal with. And it's a lot different because I'm going to give a hospice patient a lot more pain medicine than I would, somebody who's not on hospice. Their tolerance for the pain medicine is probably going to be a lot higher because they've been getting it for so long. And so there's a lot of, sometimes some of the rules kind of change for that. So pain and symptom management again, monitoring their medications, drug reviews, making sure that things don't. That's called a medication reconciliation. You'll hear that word. We did one, didn't we, on our patient? Oh, we didn't do a case study this year. So medication reconciliation is basically you list out their medicines and look and see what interacts with other ones, how you need to take it time-wise so that they don't mess with each other and that kind of thing. That's a medication med rec. Let's see. Dispensing services, so any kind of supplies that they would need, usually covered by the hospice itself. Sterile IV infusion compounding would be a part of that. Anything that they're IV-wise. 24-hour coverage. Okay, it says starter kits are a group of medications provided to hospice patients by a pharmacy. They probably have like a regular protocol. Okay, so a protocol is like, okay, so if I'm in the emergency room and I have a specific protocol, they come in with, whatever it may be, headache. Let me think of something. They come in with. I'm trying to think. It's been a long time since I've looked at the protocol. Well, here's an example. So let's say they come in and they're complaining, they fell down and they're complaining of arm pain and they can't move their hand. Okay, then it's going to go into like a protocol, like a musculoskeletal type of protocol. So pain medicine, Tylenol, Motrin. They're probably going to need an IV because they're probably going to have their bones set. So you go ahead and put on like a numbing patch for an IV start or something like that. There's like a protocol that we follow. You do this and this and this, and to prepare them to have their procedure or whatever. Same idea here. So they probably have a set protocol. Hey, these are whenever somebody signs up to hospice, these are going to be our orders. If they have, complaining of pain, we have this medicine, or this medicine, whatever. That's the protocol. Symptoms treated by their starter kits are kind of protocols. Agitation. So a lot of times that will include some kind of medicine for like anxiety or something to calm them down. Increased secretions, just because they're lying down, usually, not always, but they're usually somewhat immobile. Constipation. Immobility will always cause constipation too. So they probably would have some kind of protocol for like an enema or something along those lines. Anxiety, vomiting, nausea, fever, pain, anything like that they would have. Most hospice agencies will not allow them to take like antibiotics or something that's actually a treatment. Now, if they have something that's unrelated, like a UTI, they know I'm taking antibiotics for that. If it's unrelated to their disease, it's made them terminal. That's usually the case. They can't get treatment and be on hospice. When I say treatment, I mean treatment to make things better. And that may change depending on the hospice agency. So ambulatory care, patients can be institutionalized or not, can be inpatient, can be outpatient. So these are kind of some of the ones we've been looking at. So outpatient pharmacies, ambulatory care centers. Sometimes family. Sometimes family practice groups may have their own pharmacy within the clinic and so forth. Mail order pharmacy. These are, you see these a lot. They'll come along, like I get info all the time about the mail order pharmacy that's associated with my insurance. They dispense maintenance medications, so it's usually not something that if I go to the doctor and I have a cold and I get my medicine, that's not necessarily something I get through mail order. If I have a regular medication to take all the time, that's something that I should get. Used to, and I haven't done mail order in a long time, but used to, you always had to order a 3-month supply. Some physicians will do that, sometimes they won't. Central field pharmacies provide service to area pharmacies. And so maybe they supply other pharmacies in the area, resolves insurance claims, reviews the drug use, and so forth. Internet pharmacies, you may have one. Usually that would be like a mail order kind of thing, internet pharmacy. Nuclear, whenever you see that nuclear term, that's usually in reference to like radiation, or it could be chemo. When you see that word, you see it in a test or something, associate that with your chemo and radiation treatments. 3 types of radiation are used: alpha, beta, and gamma. And I'm not even familiar with this stuff, but says the 2 most commonly used radionuclides are iodine and technetium compounds. So again, not something that I have studied a whole bunch, but it is something you'll want to know a little bit about at least. Nuclear pharmacists must have specialized training, like nuclear physics, radiation detection, instrumentation. So they would have to go to some additional schooling. Compounding, of course, is going to be a big part of that, because for every person is going to receive different amounts of chemo or radiation depending on their weight, depending on what you're treating. I mean, that's going to change for everybody. And there's not a one-size-fits-all adult dose, or not. Everybody has their own individualized treatment. Of course, health and safety is a big issue for the pharmacists themselves, because working with radiation, if you're exposed to that, it's just exposure. I mean, it's not like you don't necessarily have to touch it or ingest it to get the radiation from it. It's emitted. So there's lots of safety precautions that go along with that. Procurement and compounding. So a lot of medications specifically have short half-lives like those. You have to be really careful with your inventory control, because you want to use up what you need to, but really careful attention. And because the longer something's out, the more it may emit radiation, and there's lots of things to follow with that. Dispensing is usually done directly to hospital or clinics and not to the patients. And they're not just going to send. I mean, some people will, like they have chemotherapeutic drugs, they may take orally. So that would be dispensed. But a lot of them, radiation is going to be done at the facility, depending on what it is. Distribution involves lead-lined boxes, and that cuts off that radiation. That's why if you go into like the radiology tech department, you wear the lead vests, so that it doesn't expose you to radiation. The Nuclear Regulatory Commission establishes the health and safety standards. They issue the licensing, and everything else that's done by that. So that's it.